Oregon is very proud of our WIC program. Every month we serve over 84,000 families. Our vision is really to have families have optimal nutrition health and that the children have lifelong health. We have the data that supports our successes. We know that our breastfeeding rates are among the highest in the country. Our children are becoming healthier, their weight is going down. In a time of an obesity epidemic, that's really important. And we know our families shop at farmers markets to buy local grown fruits and vegetables.
The WIC program is an essential public health program. It ensures food security. We know that children do well in school when they're well fed. And we know that kids who do well in school have a longer and better health outcome. So a WIC as a core public health program is absolutely essential.
The collaboration between Josephine County Public Health and All Care began as a result of a funding crisis. There simply weren't enough funds to keep WIC sustainable. We were approached, we stepped in without hesitation to continue WIC. We believe in the program for women, infants, and children in our poor community, and without it there would be gaps in care.
The partnership that WIC and All Care have in public health, it's foundational and it's changing our community, and it really embodies the whole public health modernization project goal. It's local communities coming together and finding solutions that work in our community. It's local health care, it's prevention. Yeah, it's been a real blessing, really, for everybody, the community and all the local community partners.
Public health is evolving and modernizing. We're really looking at foundational programs in public health, such as prevention and health promotion and access to clinical care. Nutrition is the basis for prevention and health promotion, and families get access to clinical care by coming into WIC. Often moms come early in their pregnancy before they've had prenatal care, and we connect them there. We have a statewide texting system that allows us to get messages out to families across the state, particularly vulnerable populations who may not have other trusted sources of emergency communication. We also help train a workforce that is prepared for public health, that's culturally responsive, and that can go out and provide the local public health services.
In America, there are real historical injustices that make it so that people of color experience hunger and poverty at disproportionate rates. And WIC helps families make sure that they have the nutrition. You know, I think a fundamental belief we have in America is equality of opportunity. In order for that to become a reality, there's no better way to do that than to make sure that kids have a healthy foundation for life. That means supporting moms when they're pregnant and through the first 1,000 days, when nutrition and development are so critical to setting that healthy foundation for life. We believe that WIC should be extended to age 6 to make sure that all kids are ready to learn on day 1 when they show up to school.
To my family and I, WIC means having a baseline of important healthy options at home always. It also means being able to feel reassured in my parenting and the ability to raise the next generation. I think if I could tell policymakers one thing, it would be never question the importance of this program. I see so many children thrive, my own included, and that makes such a difference because we can reverse poor health in other families just by taking care of one generation of kids. If WIC wasn't around, my life would definitely be different. I don't think I would understand the importance of togetherness with my children and showing them correct healthy choices. Definitely some poor parenting cycles would continue down through generations, that's for sure.
I believe in the future WIC will continue to address health disparities, promote wellness, and also address food insecurity, but more importantly, nutrition security, supporting our families with nutritious foods. I believe that kids are going to have access in the very near future to WIC services until they turn 6, because we know that we have a gap in that right now and families need our assistance. I also believe that we'll continue to change the food landscape. What all of us see when we shop at local grocery stores will continue to be healthier because of WIC.
You know, WIC is an essential public health program. I've run 2 health departments here in Washington, D.C. and in the state of Maryland. And in both of those programs, I saw that WIC provided an essential service to the citizens of our community. It reduced food insecurity. By reducing food insecurity, we were able to address things like infant mortality, low birth weight, child malnutrition. WIC is absolutely an important part of the social determinants of health, and every health department ought to be involved in the WIC program.